Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about 9 ways to get relief from osteoarthritis naturally. We're talking about joint pain.
Yeah.
You're going to have to forgive us today. We're going to show you a lot of products, but they're non-drug.
Right.
So I think that's the way a lot of people, they don't want to take drugs if they can avoid it. Right?
Exactly.
So, by the way, if you're new to our channel,
yes.
you want to take a second to subscribe to us. I don't know where I was going with that. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, you want to join us on our social media channels because we're always giving something away. Brad, what are we giving away?
The SleepOvation mattress with 700 tiny mattresses in one, and it's a beautiful device right here.
Yeah, this is just a sample of it. We could just want to have this here. Obviously, it comes with a cover too.
Right.
You know, some people are wondering, do these things hold up? And it's like, well, we've had ours for a year and a half now.
Yeah. Mm-hmm.
And I mean, mine haven't squished down at all.
Yeah,
So,
there's no issue with that.
Yeah, so.
Not with mine.
So anyway, here's your chance to win one. Go to bobandbrad.com and go to our giveaway section. Or you can also go to Facebook, Bob and Brad. It's always pinned to the top of the page. We'll give you the directions. We got to get your email and stuff like that. So I'm going to move this out of the way, Brad, and then we'll begin talking about how to relieve that arthritis.
Okay, Bob. Let's get rid of some of that aches and pains.
Yep, there we go. Okay, so the first thing you want to make sure you're doing, because we're talking about joints here, and joints have what we call synovial fluid.
That's the lubrication in the fluid that keeps them healthy and moving smoothly.
I couldn't have said it better myself, Brad. So what happens is if you do keep it moving, that synovial fluid tends to be generated.
Right. It provides nutrients and makes the joint healthy.
So you want to keep the joints moving as much as possible. Now, there is a circumstance where the arthritis gets so bad that you can't move it anymore.
Right.
But in most cases, you do want to keep it moving. So, Brad, you just talked about your hand this morning. It's sore in the morning, a little bit of arthritis. And what's the first thing you do?
Get it moving, yep. And it's a little painful at first, but the little more I move it. As a matter of fact, we've got a 92-year-old woman who's got such bad knee arthritis she couldn't walk. So we started to get her moving, and now she's walking up to 75 feet. Literally from not walking at all to 75 feet because of motion.
Yeah, it's a weird thing. You'd think that resting the joint would help, but it actually makes it worse.
Right.
So and that's why a lot of times you wake up in the mornings, you're so stiff.
Right.
Because it hurts.
That's what we're going to show some tricks on how to get through some of that initial pain.
Right. The next thing is stretches, believe it or not. We have found, or we have not found, Mackenzie kind of discovered this. Like, if let's say, for example, your knee doesn't straighten out all the way.
Sure.
Can you bring the chair over here, Brad?
Sure, Bob.
And I was going to put my leg up on it.
Oh, I thought I could sit down.
No.
It's got a backrest.
I was just going to do it like this. So let's say, for example, you have the slightest, the knee doesn't straighten out all the way. Regaining that full range of motion often will take stress off the knee.
Right.
That's hard to believe. Maybe a better example would be the hip, Brad. If you check your hips and you put one leg up like this on your opposite leg and one knee is up like this because the hip is tight and the other knee goes way down like that.
Sure.
Stretch the one that's tight, especially if it coincides with your hip pain.
Right.
Give it a stretch, pressure on, pressure off, and you'll find generally over time that hip starts to feel better.
Right.
It's really amazing. Yeah.
Right.
The more you stress, you take off the joint, the better.
What's next, Bob?
Well, the next one is going to be talking about one of the products that we're going to mention, and this is infrared heat. The reason we like infrared heat, where is it, Brad?
Hi, over here.
The reason we like infrared heat, now you can try any heating pad, but the reason we like infrared heat because it penetrates much deeper. Regular heat, and we got this symbolized. Is that a word?
Well, it shows it right there, Bob.
Demonstrates it. So regular heat only penetrates this much.
Skin deep, basically.
Skin deep, right. Thermatex infrared heat actually can penetrate 2.36 inches, right?
So that's the blue color right here versus the blue color on that side. You can barely see it there. There, we're going to get some deeper heat. It takes a little bit longer, but that's just understandable. You're going so much deeper.
So what happens in this case, Brad, where he has it on his knee,
right.
So you have 2.36 inches on one panel going through half the knee, and you have 2.36 inches going through the other half of the knee. You're almost going all the way through the knee joint.
Right. So, you have your heating pad, you wrap it all the way around, and of course you can use the Velcro pad like that.
Yeah, it's got a lot of straps.
You
that
do have
come
to
with
plug it
it.
in, though.
Yeah, you got to plug it in.
So there's a 6-foot cord that goes on there, easy on off. These are really well made. They're commercial duty.
Brad and I use these. Well, I use them even in the summer because my wife's got the air conditioner on. It's cold in our house. But I lean on that thing and I just give my back a treat every night.
Yep.
I mean, especially get the upper traps too. I mean, and it comes with straps too, by the way, that you can strap it on and use it while you're working.
Right.
And I've done that quite often.
So this particular, the Platinum model, you can use on ankles, knees. You can use it on hip, really any joint in the body, shoulder. So.
All right, next one we're going to talk about, Brad, is turmeric, and I think a lot of people, this has become all the rage to a lot of people.
What'd you say?
Turmeric.
Turmeric or turmeric?
I think it's turmeric, isn't it?
Well, that's always a controversy.
Is it a debate? All right, you guys can tell us which way you say it, but it's got a pigment. I'll give you another word, curcumin.
Oh.
I don't know if that's how you say it or not, but that's what I think is the ingredient that actually helps you. It's an anti-inflammatory.
Sure. Mm-hmm.
So and actually I saw the Doctor in How We Died, that book.
Mm-hmm. Oh,
he actually mentioned that they found out turmeric was actually more effective for treating rheumatoid arthritis than some medications.
Sure.
So it's a big deal.
As a matter of fact, we're probably going to get someone who specializes and knows more about this, and we'll have a guest
like
speaker.
Our pharmacist, you mean?
Yep. We got some other people on the line, too.
Yeah, nutritionists,
yep.
too. So, but the thing I didn't know about turmeric, the first time I used it, I took way too much. You're only supposed to take like a 1/4 teaspoon.
Yeah.
I guess this really changes the chemistry of your blood levels and stuff. I mean, you really don't want to take too much. They haven't done studies on how it affects you at high levels.
Is that why you're a little off today?
Yeah, I'm a little off. So, all right, well, moving on. Number 4, strengthening. It's always good to still keep, the stronger the joint is, the less stress there is on the joint. And one way that Brad and I have discovered that really is a great way to gentle strengthening without putting as much stress on the joint is to use strengthening bands or tubes.
Right. Obviously, this is something that, any therapist, we've been using these for 20, 30 years.
We got things in the way here.
Oh, my goodness. We got obstruction. Let's get rid of those.
Okay, how are we doing? Are we okay? We're finding Brad?
Yeah. Yeah. So we got the bands with the handles. These were really nice because the handles, you got a nice soft device to grab onto. And it's nice to have something to hold onto on the wall.
And we have our wall anchors, so we'll have that listed down below too. But as a good example here, Brad, your tag is sticking out here. This bothers me.
No,
so as a good example here, I was really having a lot of elbow pain with doing curls with the regular barbell. And so I had to adjust and actually start using these for a while. I actually went back to the barbell now.
You did?
Because I went through a period of doing this for a couple of months.
Yep.
And I like it. But I want to go a little heavier weight,
right.
And so I went back to that. But that allowed me to re-strengthen my joint and not have as much pain, and so I don't feel it anymore.
I'll never go back to the barbells.
Yeah, I know. You do
I
well
love
with the bands.
I've got a whole system set up, and there's nothing better for me.
Right. Next one. If you have osteoarthritis and you want to get some relief, especially in the joints that are weight-bearing, you want to decrease the weight-bearing. As simple as that.
Sure.
So when you're walking outside, one, you want to avoid hills. You want to avoid stairs even too. You don't want to overdo them.
Sure.
You want to maybe try biking. That's one way to decrease weight bearing.
Right.
You could also use a walking stick or a cane.
Yeah, bet.
And one thing I warn people is that they go, well, I'm not going to use a cane. I look old. Well, sometimes it's not a matter of permanent change. Sometimes if you do it just for a while, it calms the arthritis down, and then you can go back to walking without a device.
Right. That cane's too short for Bob, by
this
the way.
is, and by the way, 1.2 to be made is, believe me, it probably looks better to walk with a cane than to walk like this.
Right.
Because you're limping so bad from the arthritis. So it'll probably look a little better to walk with a cane, distinguished, like an English gentleman,
right?
Than trying to waddle.
Waddle,
over
right?
Yeah.
And when you waddle, then you're putting pressure on other joints, and it compounds, and it causes one problem to another, etc. So.
All right, this next one I've really benefited from, Brad, is that Actually, I get pain in my hips a lot of times, especially with running.
Sure.
Or I did anyway. And sometimes it would actually throw me off for a couple months. I'd be like, oh, I'm really limping through this. I was thinking, oh, am I getting hip arthritis and stuff like that?
Yeah, getting old.
So I started doing massaging the muscles around the joints.
Yeah.
And I use a,
You get your wife to do that?
no, 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 no,
No, she
no.
won't. She's
Brad,
not
this is
gonna
a family
touch you
show.
anymore.
So anyway, you can take one of the handheld massagers. The Renfo massager is really nice because it's cheap. These are inexpensive, I should say. They're 40, they're $40. I mean, man, how can you beat that? So I'm going to go ahead and turn it on here. But you can go ahead and massage the different areas. You're finding a lot of professional athletes have discovered this now,
Sure.
and that's why they're prolonging their career. We got Tom Brady, quarterback. He's actually a big believer in pliable muscles.
Right.
And he uses a vibrating foam roller. That's what I actually use, a
Sure.
vibrating foam
Yep.
roller. And it's just real quick, but it gets the muscles. They're really ready for running once I get it done.
Right. So whether it's the roller or this, you're getting into the muscle and you're getting it to relax, and you're really essentially increasing the circulation. And when you got increased circulation, it's going to be much healthier.
Yeah, you think like, well, why am I massaging the muscles when it's the joint that bothers me?
Sure.
The muscles go across the joint, and if
Right.
they're really tight, they're going to put more pressure on the joint.
Sure.
So the last one, Brad, which may be not obvious to a lot of people, is that you should get enough sleep. I mean, that's really kind of been a epidemic of the lack of sleep in
Sure.
the United States. We've talked about this often. It seems to be a badge of courage to not sleep as much. I only get 4 hours of sleep a night. I only get
Right. Well, I lived for years on 3 hours of sleep. Yeah, no wonder. Look at you.
yeah. You look like 100 years old now. But there's a recuperative nature of sleep, and it's going to feel better for arthritis
Yes.
and any other ailment you have.
Right.
It's generally going to helps what ails you, right?
There you go. You really can't go wrong with a little bit of. And make sure you get that sleep time taken care of.
All right. So sleepy bye, and
Oh, we're almost out of time, Bob.
all right. Well, thanks for watching, folks.